So a really warm welcome to you all. Thanks so much for joining us. We're really grateful for your time and for your interest that you've shown in hearing about what we here at UWS are doing in response to the coronavirus and COVID-19, which I'm sure, just like you, has occupied our hearts and minds for the past few months. So thank you for the questions that have come in. We've based this evening on making sure that we answer those. So to start us off, I'll give us a brief overview of UWS and our COVID response. Then we'll hear from our expert panel. And then we'll leave some time for questions that come up during the webinar at the end. So if you do have a question, please do feel free to ask it using the chat function, and we'll make sure that we field those questions to the right people. If we don't have time during the webinar, we will do our best to follow up with you in writing afterwards. So just to briefly introduce the panel that we have this evening, I'm Gemma Barker. I'm the Associate Director of Programmes. I've been with UWS for over 3 years now, working on education quality and child protection across all 3 of our countries. Today, I'm delighted to be joined by Tim Howarth, our CEO, I'm sure many of you know, and Surya Karki, our Country Director for Nepal, as well as Greg Rose, a public health specialist who's registered in the UK and a Fellow of Public Health. So I'll give us a brief overview of UWS and then we'll get to our panel. So at UWS, our mission is to improve through education life opportunities for some of the world's poorest children living in remote and marginalised communities. We work alongside governments and communities in rural Nepal, Myanmar and Cambodia to teach the unreached. We've been working really hard to adapt our approach to this pandemic while keeping true to our mission, as well as ensuring that our approach takes into account these really complex nuances of each of our contexts, but also working with other peers and other actors to ensure that we complement what is already being done. In the 3 countries that we operate, the national COVID response has looked quite different. Nepal has been on strict lockdown now for over a month, and the cases are steadily increasing. Whereas Cambodia has had no new cases reported since middle of April, and all of their reported cases have recovered, and they're now starting to reopen their land borders. Myanmar sits somewhere between the 2. They started off with a slightly gentler lockdown, but now they're enforcing increasingly strict measures. And these measures that are actually being taken to protect people from COVID are having strong impacts and lots of negative impacts in our country, for example, on livelihoods, as well as on long-term socio-economic impacts. And just to highlight how serious some of these are, just this week I was speaking to one of our staff members in Myanmar, and they said from their window they heard a man walking down the street and shouting, and when he asked what the man was saying, he was actually offering to sell his children's labour in exchange for oil and rice. So it shows that in these countries, the lockdown is actually a really serious event that, that impacts people's daily lives as long term. As well as that, our schools have been closed for over a month in all 3 countries, and this results in a loss of education for our children, but also a loss of safety and routine that the school offers. Here at UWS, we are really aware of our unique and privileged position to be able to react effectively to what is both a health and also an education crisis. Now, UWS's model is to embed ourselves into the communities, and this has proven really vital during this time. We do it in 2 ways. We employ local people as teachers, community teachers, and then we also create a school support committee, which acts as a local governance structure. So we don't work alongside the community, we work through the community. And this has supported us to be trusted, and this trust has proved really vital during this emergency time. So everything we're doing is through these local people, and as I'm describing our response, it is these local teachers and local school support committees who are doing all the work. So our response initiatives are divided into 3 main areas. We have our WASH, our awareness campaign, and our education campaign. And in all 3 of these areas, it's really important to say that we've been really focused on interventions that are not just crisis interventions that will be beneficial for the short term, but long-term benefits that will support our mission as well in the long term. We're also really taking care to make sure that our principle to do no harm is at the heart of all of these interventions. We are a child-centered organisation, and the safety of the children is at the heart of our decision making. This has meant that we've done very careful research and risk assessment before putting any interventions in place. So our WASH intervention, in line with the revised World Health Organization guidelines, we've spent the past few weeks upgrading our hand washing facilities across all of our communities and promoting good hand washing practices. So far, we've opened hand washing facilities to the community in 37 of our villages. We are adapting more facilities every day, ensuring that the taps are at safe distances and the queuing systems are set up safely. Where needed, we're increasing water capacity and making other necessary repairs using the funds raised through our COVID-19 appeal. Our awareness campaign. So we've been working through our community teachers who are communicating those key public health messages to all the communities and of course our students. We've also been focusing on well-being, and this has been as a preventative measure to reduce the rise in child protection cases that has been seen globally during this crisis. So this awareness and well-being campaign has now been successfully launched in 97 of our communities. And the messages of these campaigns will continue to be repeated because we know that behaviour change doesn't happen overnight and it does need continuous revising. And then in terms of our education, our teams are working, as you can probably imagine, very hard, and we're working on filling the gaps from the ministries of education in each country, the appropriate systems to ensure the continuation of education. And this is a big challenge in areas with little or zero technology. And this education continuation part is also a really good opportunity for us to repeat our campaign awareness and wellbeing messages. So I'll give you some examples. In Myanmar, we have been using a story called My Hero Is You. Some of you may have heard of it. It's a story about talk about their mental health and their psychosocial needs during the COVID outbreak. And we've been reading that story to the children and doing lots of really exciting follow-up educational activities with them. And then another example is in Cambodia, our team have actually written a very catchy hand washing song, which they are teaching all the children and staff because they quite like it as well. So at UWS, as many of you know, our work relies on voluntary donations. And without the continued compassion of supporters such as yourself, the scale and depth of our response would simply not be possible. We launched our appeal on the 8th of April 2020, and so far we've raised 45,000. And we still need to reach our total campaign target of 250,000, and this will help us to make all the necessary adaptations to provide hygiene provisions to all of our 226 communities across these 3 countries. So as I've mentioned, one of our 3 responses is water and hygiene. And we're really grateful to have been able to work with a leading industry expert, Greg Rose. He has over 20 years experience in the public health sector, as well as working in many crises. And he's been working with us to ensure that our WASH interventions are safe and effective. So Greg, using your extensive experience as a seasoned public health professional, can you share with us a few of the lessons that the sector has drawn from these previous health crises?
Thanks very much for that introduction, Gemma. I think it just shows that I'm old. I think in terms of both health and WASH, water, sanitation, hygiene, one of the things I've noticed in the sector is that there can be a tendency to almost miss the big targets, what it is we're trying to achieve. What it is what is the action that's most likely to have the greatest impact with the minimum use of resources. So something that's cheap and also easily managed, able to do. Mainly because we're quite often the people who are the first responders are communities themselves. So we haven't got public health experts or WASH people in the field a lot of the time. So the actions that are they're going to have the biggest impact have to be identified, and that means good assessment, which means really knowing your communities and knowing what those risks are. And I think, take for example Ebola, which is another example of person-to-person transmission. A lot of lessons were learned there from that failure, really, to understand what are the things that are driving the epidemic. Things like people congregating at funerals, and that became very important in controlling the epidemic. So as soon as that was in hand in Liberia and Sierra Leone, cases started to drop. And also, there's the tendency to do things that are they're very big on display. They're very dramatic, like for example, residual spraying when the Zika outbreaks happened. So you get people fogging, using fogging to kill off mosquitoes, and we know that it doesn't really have that much of an impact on disease spread, but it looks good for the cameras. So there's a tendency to do things that are of a grand scale without really identifying those things that are for resource poor environments, and which will have a big impact. A good example more recently, of course, is the building of hospitals for COVID-19. And quite often they're too late. They're too late. We saw the same thing in Ebola. They're built very late on. They're very high tech, and they might not even be used in the end. And I think the Nightingale has been barely used, really. And so certainly the same happened in Sierra Leone, where a lot of resources were put in by the British military. And in the end, a low number of cases by the time it was established, which would have been probably at the beginning of the year after the disease had peaked. So sometimes we invest in things which have too many moving parts. They're very difficult to orchestrate and difficult to manage, control. So keeping things simple is really important, and I think that's what we've tried to do with developing this WASH approach with UWS. And communities, what I said about communities being at the heart of it, it's not just paying lip service to that. Things will work if you know the community, if you know what's likely to cause a risk in the community, and what's likely to work, what will people actually take on board and accept as a restriction to their life. And we've all been living with that at the moment, and we have to know. I think the British government might have had more success had it really understood what people would be prepared to do, and then whatever system you decide on, whatever intervention you decide on, making sure that you've got all those systems in place to make it work. So some of the failures you saw in places like Bangladesh with hand washing, it's because they didn't have those systems in place. A lot of what was done was around communication without having the hardware established and people's use of the hardware organized. So keeping things simple, making sure that community engaged, and understanding what motivates communities, and then I suppose to be more specific around hygiene, and we'll get onto that a bit later. Making sure that hygiene isn't neglected. In all public health crises, hygiene is usually at the fore, and it's quite often neglected. Does that kind of sum up some of our lessons in the field, Gemma?
Thank you, Greg. That's very interesting. And from what you've seen and observed from your time with us, what do you think UWS is doing to ensure that these mistakes and lessons are being adhered to?
Well, they're certainly prioritizing hygiene, and I'm impressed by that, given that you're primarily an education charity. So it's quite often, even in public health, hygiene is neglected. You're an educational establishment. You're really putting that at the fore, which is great. So you're also learning from, you know, what's known around the pandemic. You're using teachers from the same communities as the leaders, so they're credible people who can influence communities, which is really important. Using simple, precise messages with language that reflects an understanding, and I think I think Surya later on will describe some of the language you're using. So not getting into really complex things that quite often, even in our cultures, we don't understand, things like flattening the curve and social distancing that might not mean anything. So using a language that people can understand, which you're doing. And you're also recognizing that children are an asset. And we've seen this so many times in public health campaigns, from road safety through to cleaner water, that children can be an influencer on their parents, checking that they've got their seatbelt fastened. And this is really important because children are open to ideas, and they can be used to great advantage in affecting behavior change. You're adapting whatever hardware you've already got, and you already have hygiene facilities in most of the schools, but you're adapting those to ensure the safe distance between people, that there are markers to guide people. We need that. In Europe, we've seen that sometimes where social distancing hasn't worked, people aren't maintaining distance between each other. It's because they're not really being guided enough. You've got plans for monitoring, so that very early on in the first or second day that you're establishing some kind of hygiene facility or a campaign, that you're able to monitor what action is taken, so that you can immediately rectify any problems rather than wait for an evaluation. You're nominating people so that there'll be a named person with responsibility for communication or maintenance or crowd control or the monitoring. And also UWS has taken heed of some of the pitfalls in response, so that the campaigns are done in a consistent way. So you're saying the same things and communicating the same messages in each location. So you're not just working, each country, for example, isn't working in isolation. And that's not just a communication around risk, but also the way that you're promoting your services. So I do see UWS as a great example, a small, relatively small organization that's doing what, their approach to this is really, really intelligent and measured.
Thank you, Greg. And I just want to share a small anecdote about some of the lessons that you helped us to learn. I really appreciated your point about language and how important language can be in keeping it simple. And one of our campaign messages that has been very popular with children and adults alike is, instead of social distancing, we're trying to use these in Greg, and we've been portraying 2 meters as the distance of a cow, and that's been really taken off, and the children are enjoying talking about cows. So Greg, do you have any advice for us for the longer term?
And I should point out that the cow analogy came up completely independent of me, but I approve totally.
We'll give you the credit for it.
So in terms of lasting impact, well, I would say that public health is probably a neglected area anyway in most of those countries that you're working in. So the fact that you're doing something now is a sort of seed for the future. And schools are a great starting point for that. If I think of my own education, I would say that health education, that it was quite subtle, probably in the days that I was in school. But I remembered a lot of what I learned in school. It stuck with me. So I do believe schools are a great starting point for stimulating community awareness and the links between people's health and their behavior and their environment and the risks in the environment. And it's so often linked, and again, I think Surya will probably talk about this in relation to Nepal, the impact on the economy and household income is so marked in these situations. We saw it in West Africa and Democratic Republic of Congo with Ebola, which obviously is a much more severe severe disease, but it has the same impact when people aren't able to move in coronavirus. So schools can lead this so that the impact, the economic impact, will be less in the long term. It may also be possible in the future for schools to encourage some dialogue with the education departments to influence the curriculum, because I do believe that those governments will see this as much greater of greater importance now, and that health education should be part of the wider curriculum for schools. And in your kind of day-to-day work, this will inevitably lead to placing greater emphasis on water, hygiene, and sanitation in your schools, and that will have an impact on waterborne diseases like hepatitis A, giardia, dysentery, cholera, E. coli, typhoid. So there are so many diseases that are kind of endemic in these countries that it will have an impact on. Lastly, probably, it's hard to measure, although it's not impossible. But I have seen programs like this, simple wash interventions, which have had an impact on under 5-year mortality. So you can actually save people's lives, even beyond COVID-19.
Thank you, Greg. And if anyone does have any questions for Greg, please don't forget to put it in the chat function here, and we'll make sure that we get that to him. So I'd now like to bring Surya in on the discussion to build on some of what Greg has said. And I just want to acknowledge that it is very late for Surya. So we're really grateful for him for joining us. So Surya led the setup of UWS in Nepal, and he has supported the team there now to grow an organisation that has enabled 5,200 children to have an education, which is a remarkable thing. Surya, can you please tell us a little bit more about what the response looks like in Nepal, bring it alive for our participants, and what do closed borders mean for the country and for the people?
Hello, everyone. Good evening from Nepal. It's almost morning now. I forget times because lockdowns doesn't remind me of days. We've already been in a lockdown for 45 days and been stuck at home with my sister and my mom for the longest of times ever throughout my life, I think. As for the country, we are 20 days ago, if I was asked this question, I would say we were pretty hopeful of opening the economy up. The cases wouldn't have gone up. The testing was being ramped up and everything. But 45 days into the lockdown, the government seems to be caught up in a political turmoil of changing leadership within the political party and more of the things. There is less of a focus on ramping up testing. We've only done 64,000 tests. So far we just crossed the 100 cases. The ones that recovered have come back to the hospital. It shows how our healthcare system is. If we had 5,000 cases, serious cases, only less than 300 people would be on ventilators. So we are looking for a pretty doomed up case, at least for the country. But the lockdown has definitely provided some relief, because we've had very strict lockdowns. We're not allowed to move out of the house. We're not allowed to go out anything, not for even getting your supplies, anything. You're totally stuck in. Some of the industries are working, the delivery companies and every such once in a while are operating, and so therefore the country is actually functioning. Now, the COVID-19 presents a very, very big challenge for the country, specifically because the 400 million young people that are working as migrant labor, sorry, not 400 million, it's 4 million young people that are working in several parts of the world as migrant laborers are in a very, very dismal state. And there's been a conversation within the government to bring back almost 20% of them, because their companies have laid them off and are in the process of doing all the paperwork that is required. Now, with 20% returning back, that would add 20% to the people that are unemployed, 20% that don't provide remittance, which is around 28% of the GDP for the country. So we're seeing 28% of the GDP being impacted over the next however many months this whole thing is going to continue on. The tourism industry is all shambles. All of the hotels are closed. Bookings are all canceled. For the next 6 months, we're looking at something where nobody's getting paid a full salary. And it seems like people are going to now head off back to their rural areas and work as subsistence farmers. That being said, I would definitely say, with the number of cases that we've had so far, it doesn't look very scary. But over the next however many weeks the lockdown continues on, we're gonna, if the test does not get ramped up and the economy opens up and the border to India opens up, then we're looking for a very, very disastrous public health situation in the country. But we're already affected economically. We're also affected both in the number of cases as well as lack of leadership. But yeah, and I think in these times of crisis, everybody, including in the communities that we work, they're looking up to organizations like us and several others that are working in the field, hoping to continue to take on the role of the government.
Sounds like a very difficult time. Thanks for highlighting the difference there between how a lockdown might look in the UK, where for some it's quite a pleasant experience, and then in Nepal, where a lot more complicated. So now can I ask you a bit more about what our teams have been working on?
So once we went into the lockdown, a day before the lockdown, we decided that we'd work from home as the cases were ramping up in the country. And I think that's when we decided that we'd want to continue providing the services we would be providing. So as long as the government was handling the public health side, we were trying to focus on the education delivery aspect. But as the government slumped down on supporting the communities on, wash, sanitation and everything, the guidance from the whole team in the UK, as well as Greg, everyone, we decided that we'd be focusing on the 3 different elements: the WASH awareness campaign, as well as the overall education attainment. And so this is where we've gone pretty well ahead in the whole spectrum of the work in COVID-19 response here in Nepal. And we've had 21 of our WASH facilities open to the communities that are in different parts of the west and the eastern part. So Sangkwa being one of our major hubs, we've had around 16 of those 16 WASH facilities open, and Gulmi, which is the western hub, which is around, I'd say, 13 to 14 hours from Kathmandu, has around 5 to 6 of our WASH facilities open. So far, in a week's time, we've seen over 3,500 people benefit from these WASH facilities that have clearly marked social distancing rules, and also provides soap, washing facilities, as well as different other awareness messages put on in the WASH facilities. That being said, this is something that we're doing in collaboration with the local governments. We brought them in. They've also now decided that they'll share costs with us. That being said, it's still in negotiations, but having the government on our side is a success for us. I'd definitely say another one that has really been a hit for us would be the education side, which is what we've been the leaders, at least in the whole country. Several organizations, including government, is still figuring out how to continue with the education aspect of the children that are currently outside school and stuck at home. We initially, in conversation with the programs team decided that we, at least in Nepal, would do a radio program where the overall education, daily education of children is continuing on. So every day we got an hour-long program, 30 minutes in Songkhla and 30 minutes in Gulmi, that is played in the district regional FM radio. And in the time we've had the program playing every day, there are over 8,500 children that listen to our programs. All of this was done by the programs team, initially conducting a survey through our community teachers, our head teachers, and also the government as a whole. When we initially started, we looked at collaborating with the local government, but when the government didn't have their own pathway or direction in terms of providing education, they were not really on board. But as soon as the program came out, we've had over 7 different municipalities wanting to take on the program and broadcast it through their respective radio stations. So over the next however many weeks the schools are closed, we continue to deliver the programs. The programs are pre-recorded by the team here in Nepal from home, specifically by the fellows, the education officers, and they're sent for editing to the FM stations and get delivered. So every day around 8,500 children, that's a big reach for us. And that's probably going to go up in the coming months, coming weeks. And also another important thing is our infrastructure is being built the way they were built. They've been used as quarantine places. Approximately 5 schools have been used. One such, just wanted to give a shout out to Kim. The school is being used as a quarantine area in Songkhla, and also there are a few other schools that are being used as and just having those become a focus, a center of the community is a big privilege for us. As we go into the uncertain times that the country goes through, we as the organization focusing on preventive measures, WASH, which is not a very sexy thing, it's just important for us to continue that. I think we've achieved and prevented quite a lot of diseases in these communities since the times we existed. And for us to continually be taking on the role, the lead to help these communities that are in crisis is going to be crucial for us. And just receiving the support that we've been receiving so far in the WASH campaign, I just want to thank every one of you. Without you guys, it would have been impossible. And so as we continue to look to the next few weeks, few months, I think continuing on the prevention side is going to be very crucial for us. The WASH facility, the focus on sanitation, and also continuing to invest in education. I think that's the only key, the only solution to poverty in this country. And as we, the uncertain times are going to be delivering quite a lot, and I think that's going to be very crucial for us. So any support, any help that can be provided in the WASH side of our response to the COVID-19 will be very, very appreciative for us.
Thank you, Surya. And just coming back to your point about the health, we hear a lot in the UK about, like Greg said, the hospitals being built to support with the increased demand. How would the health system in Nepal cope if and when cases do start to increase?
With the majority of the country being rural, approximately I would say around 70 to 75% people live in rural areas. Hospitals are very city-centric, and if there was a serious case to happen in Songkhla, which is the eastern hub for us, I would say somebody has to be airlifted from there to bring them to either the plain areas, which is the state's capital, or Kathmandu. Now, the person has to be lucky enough to be provided a ventilator. It'll be the number of cases. If you're the first case, then you're going to be provided a ventilator. If you're probably the 305th case, you're probably going to have to wait until a ventilator is built or brought in. But so I would definitely say our healthcare system is not really ready for a crisis like this, and we're still dealing with dengue fever. We're still dealing with malaria. And this is an added burden for us. In times when we don't have good leadership, expecting the government to invest on quarantine areas, invest on temporary hospitals, would really be expecting too much from them. And so, for example, I would say one of the schools, the first schools is Mude, which is in the eastern part of Nepal. It doesn't even have a properly working clinic. And now, if there was one case there and about 100 people got infected, the village would be in drastic, very, very unimagined crisis. And so the country is not really ready for it. And preventive measures are the only way that this country is going to continue to survive. Expecting the poor people to benefit from the healthcare system is going to be a very big ask. And for people that are economically well off, it's going to be very easy for them because the system caters to that. And so I'd definitely say we're not really ready for this crisis. And if this crisis really hits us hard, then we're looking for another 10 years of being pushed back into poverty again.
Yeah. If anyone does have any questions for Surya, please do put them in the chat and he will do his best to answer them. So I just want to pick up on your point about the preventative measures, Surya, and I want to come back to Greg. We've been working together on focusing on hand washing and good hand washing practices. But as you've shared with us and as we've learned during this process, it's not as easy as it may sound. So do you have any specific examples of how to promote hand washing behaviours and also any advice that you have for us?
Yeah, well, it's not simply that hand washing is an oversight, but that's primarily the problem why in emergencies we don't get hygiene promotion, or we get hygiene promotion just in terms of campaigns and messages. Hygiene, as we know, is the kind of cornerstone of public health interventions. It's one of the things people think about or associate with public health. But in resource settings, it's not the easiest thing to do. You'd think it would be the easiest, much easier than, say, providing clean water for drinking or sanitation, but it is actually very difficult. And there are a lot of reasons for that. I would say that it was probably the single greatest failure in humanitarian response to provide emergency hand washing. First comes drinking water, then comes sanitation, and last hygiene if it's thought about or if there's time left. And one of the reasons for this, apart from just the oversight, is that you have to move quite large volumes of water in often water scarce areas, and you have to have them in that water stored in a way that uses gravity quite often. And so the placement of the water has to be right. You have to have soap available, and the soap has to be secured, otherwise people will steal it or borrow it. And this is quite common. So you end up with a lot of hand washing stations with no water in them and no soap. And if you go to Bangladesh and you see the Rohingya camps, you'll see that. You'll see empty blue vessels and no soap. So they have to be regularly replenished. So the way to ensure that this is done properly is you have, if you have small containers, you have to frequently replenish them. And I know that UWS is investing in larger containers so that they can store, say, 1,000 litres of water, which means you don't have to replenish so frequently. If you had a small jerry can, you'd be replenishing it 3 times a day, depending upon the number of people. So I know that UWS has already thought about, how you overcome some of these simple but actually very challenging problems around water and soap, about securing soap and about getting the water to the people. But I'd say the 3 messages you should take from it are: you have hardware for hand washing, which is effective. In other words, it allows people to hand wash easily without contaminating surfaces. You have the hand washing conveniently placed and at the right time, so people can wash their hands. And you have a system of managing and replenishing it. And I know that EWS has thought about all of these things and is putting in place systems which are really important if it's going to go through the risk period of this epidemic.
Thanks, Greg. So we're going to move on to our Q&A part of the session. We've had a question come in, which is about, we've been talking about what we're already doing, and I want to come to Tim for this question. What more can we be doing, Tim?
Gemma, thank you, and thank you very much. Good evening. Love to see so many familiar people on the webinar as well. Really, really great to have everyone here this evening. It's a fair question, and when we rapidly redesigned our programs, I think we had a few guiding principles in mind, and one of them was, we're an education organisation. Education's a long game, so therefore we need to put in place the things that will ensure the schools are there for the long term. We've got a duty of care to our communities, we've got a duty of care to our donors, our supporters, to make sure those schools are there and are doing the job in the community for as long as possible, and therefore delivering that transformational change in children's lives as a result. So one of the guiding principles in terms of what else can we do is, well, let's keep the end game in mind. So the end game therefore allows us to work backwards. And so what else can we do? We would like to scale up our education programs in all 3 countries during the time of COVID-19. We know that there's some innovative activity taking place, radio programs in Nepal, we've had distance learning in Myanmar, distance learning in Cambodia. There are a number of educational pilots that we can do ourselves, that we can learn from others, but we can put in educational interventions that keep the learning going. And so that when the students return to school, and it is when, we're in the best possible place for those students to continue their learning in school, but there isn't a big gap whilst, of course, these schools are closed. There's an awful lot more I think we can do with WASH. I mean, it's great to have someone like Greg with us. We deliberately, I think, played to our strengths with our WASH strategy, which is, let's use our existing resource, but also let's not claim expertise that we don't have. We approached this relatively humbly and said, well, we need to learn from people like Greg, we need to understand what good looks like, and then we need to work out what we reasonably can put in place in our communities. Now, we've done some of the stuff we can do initially, and I think as Gemma touched on at the start, we have been able to put in some upgraded water and hand washing facilities, which is fantastic. There's an awful lot more we can do. We've actually got an audited program that if we can get it funded, there's an awful lot more we can do across our communities, which can actually impact 150,000 people through this this current pandemic, through simply as having good hand washing facilities, and Greg's outlined how that we put in place. I suppose the final thing we can do, and we need to do, and again this is about the long term, the long game, is maintain those trusted community relationships. We work with marginalised, vulnerable people that are often beyond the reach of the government sector. And so by working with them, we are embedding our trusted relationships with them. To some extent, and I think Greg's expression was a good one. They said, well, children can be both an asset and an influencer. So therefore, through our relationships with the young people in our communities, we can be hopefully an influencer for good. We're able to help develop some of the community relationships further and deeper that mean that these ongoing relationships are there for the long term when the schools reopen. So I hope that gives a flavour. We've done the things that we think we can do quickly. We're piloting some of the things in education that we think could work and could scale, and we're looking at those carefully with the prospect of scaling it up. And of course, with the fantastic support that we receive, we're able to do as much as we can, and to some extent, that's why it's so helpful to everybody on this call, that we're able to tell you what we're up to, and obviously if you know people that can support us, we need to hear from them.
Thank you, Tim. We've had another question come in, and this one's around our teachers. And just to give context to this question, we employ local community teachers who speak the language, but we also work alongside government teachers who are also employed in many cases in our schools. And the question is asking what are we doing to support teachers while they're not in the schools? Some of them will have had to go home, that depends on the context. And what challenges can we foresee with them coming back to our communities? So Surya, would you mind taking that one and giving us a bit of update about that in Nepal?
So in terms of state teachers, I definitely say the lead in all of our community schools are all state-funded teachers. So all head teachers are state-funded teachers. And throughout all of our engagements, we've been involving them from getting the radio program out to ensuring that the WASH facilities were open, to ensuring that all our community teachers were continuously engaging in conversations with them. So I doubt that they wouldn't come back because one of our our newest school that is opening up, Boraruk, funded by Fly and Help, is we thought we wouldn't get the state teachers that were committed, but the head teachers already working on with us. And so that shows the commitment from the local governments. And also another important thing is right now there's already a debate going on within the different local governments where we work about how they're going to continue to engage these teachers that are being paid but are not working. So we are guiding them, we're supporting them. And I think one of the things they are planning to do and tag along with our program is create content with us. Right now we're engaging our community teachers and fellows, but as we see in the coming weeks, the government directive might come out as to they have to work with us. So at least in Nepal's case, we do not see the government, the state-funded teachers not returning back. It seems like they will continue to engage with us. And as for the support provided to them, we have different groups that we've created. When I say groups, that is community teacher and our teacher groups in Facebook, as well as there are other groups within the larger United World Schools Nepal Facebook group where we engage with our state as well as head teachers as well as the community teachers and fellows. So we're using them as much as we can to continuously spread the message of COVID-19, talk about the pandemic, talk about it in a way that people understand, which is what they're very good at doing. So I doubt they're not gonna return back, but you never know what's gonna happen. The budget cut is definitely gonna happen. When I say budget cut, I just wanted to mention this out, which was so we're very heavily dependent on foreign aid to continuously fulfill our budget. So it's around 24% of the total budget comes from foreign aid, so supported by Wellbeing, ADB, different donors around the world, as well as EU and different people. And with remittance coming down, with the foreign aid coming down, we will definitely see a decrease in commitment from the governments and to provide support to our schools in terms of increasing the number of teachers they fund. But as of right now, that's just speculation. But I'm pretty confident that the new budget will focus more on the health sector and preventive measures than on the education side, which is a pity for us, but that's expected. But the existing teachers will definitely return.
Yeah, thank you, Sir. And just to build on that, I'm actually part of a lot of these messenger groups, and it is a really active group. And it's very hard to tell the difference between the community teachers who are our UWS teachers and the government teachers because they are so behind our cause. And that's certainly the case in trainings that we've delivered as well. The government teachers are always just as eager, which is really a good sign of our engagement. And then just to actually, a lot of our teachers are already coming back. They're coming back in phases, and we've seen a good percentage of people coming back, and we haven't had any indication that teachers aren't coming back. And in terms of the challenges that poses, it just means that we are doing another phase of our awareness campaign to make sure that our government teachers are also in line with those social distancing and hand-washing messages. And then in Myanmar, there's a bit more of a risk because the teachers do come from further away, but we are engaging them as much as possible. Our education officers are in contact as much as possible, sometimes daily, and we're engaging them in that way. So I have another question. In Germany, the lockdown is now being slightly released. Is there a perspective for Nepal when construction schools and regular schools might start again?
Thank you for the question, Emily. So we are allowed to start construction as of today. So the government issued a new directive saying from tomorrow we can actually start construction works can initiate. But one of the things that we are impacted by is the availability of materials. So we're going to be looking at approximately another 15 to 20 days before all the materials are put together and are available in the market. That being said, one of the things that we're being blessed with as we speak is the rain. These are times when it's dry, but unfortunately, it seems like the climate change is also another crisis that will continue to hit us. So we've had torrential rain for the past 3 weeks. This is not monsoon time. This has to be dry season, but farmers are freaking out. Everyone is, wondering what's going on. We were expecting dry seasons up until June, but it's already, we already had higher rains in April. It's not even summer. We've got around 21 degrees Celsius, which should have been 32 degrees Celsius now. But it's just, but yeah. So I can only say we are allowed to start. We will definitely be starting the constructions. But as soon as the materials are available, we'll transport them to the construction site, including mobile, which is what Emily is really interested about. We already have some materials transported. The only thing that is left to be transported is one of the most important elements within the construction. So we're looking at a horizon of another 15 days, or maybe maximum of 15 to 20 days before construction actually ramps up.
Thank you. And just to highlight that even those construction teams, they're also following our social distancing and hand washing practices. Tim, can I come to you for a bit more context on this question in Cambodia and Myanmar?
Yeah, I think the honest answer is we don't honestly know. The lockdown has not been as severe in Cambodia as other countries. To some extent, the government's response, I think our team have felt has been a little bit muddled, a little bit inconsistent at times, which for those of you who know Cambodia is not actually unfamiliar, and it's just what we get on with every day. In Myanmar, again, I think it's a little early to tell. The conversation with Kay, our country director, a couple of days ago was very promising, though, that she was saying, look, we think through distance learning, we think through some of the revised programs we can put in place that we can open up pretty much all of our schools in June, which is the start of the next academic year. So there is so much uncertainty, and I know we've got a number of people here who run businesses for many years. I mean, I've heard so many people say that they've never known a time with more uncertainty, and so we've got to recognise that. But we are still focused on what we can do and what we can control, and we think it is very possible that we'll be opening the Myanmar schools in the second half of the year, and the Cambodian schools in November, which is the start of the new academic year. Yeah, absolutely.
Even when these schools do open, we are working hard to make sure that they're still safe. Even if the national policy is that everything's okay, we still want some of these practices to be embedded. As I mentioned at the beginning, these are long-term improvements that we can make to education and our programs. I have another question. So we have some people on the call who are sending out information to parents next week, and just they would like some context about how much it costs to put hand washing facilities into a school or community. So I'll come to you first, Greg, not specifically about UWS costs, but just industry perspective, and then I'll come to Tim.
Okay. Well, obviously the most apparent thing is what work needs to be done. So if it was something like simply purchasing a large container, you could do that for a couple of $100s. If you were doing something a bit more complicated, like setting up a solar system to replenish the water, again, you could do that quite cheaply for a couple of $100. But once you start doing things like networking of pipes and then the labor involved, it can be $1,000 to $2,000.
Mm-hmm. Thank you. And Tim, would you mind just taking that one more specific to UWS?
Yeah, absolutely. So the overall budget for upgrading our WASH infrastructure is looking at around $200,000 to upgrade all of our schools across the 3 countries. On a sort of per project basis, that looks like around $2,500, but there's a lot of natural variation in there for the reasons that Greg just outlined, i.e. for some of our communities, actually, there are some pretty efficient, light touch, very, very cost effective things we can do very quickly to get the WASH facilities up to World Health Organization recommended standard. Other communities will need some quite heavy infrastructure, and Surya's touched on that, and of course, Surya's also brought to life some of the challenges of actually working in these remote communities as well. So the overall WASH budget, i.e. what we're trying to do overall with all of our communities, comes in at about $200,000. Specifically on a community by community basis, that works out an average of about $2,500. So if that helps give a little bit of context to the amount of money we're talking about, a typical community we work with could be anything from 500 to 1,000 people. So you can see how efficient sort of $2,500 worth of investment can be.
Thanks, Tim. We have one last question, which we'll quickly answer, which is, what are the statistics in Myanmar and Cambodia? And I can take that one. As of today, there were 161 cases in Myanmar and 6 dead, but no recovered cases reported. And in Cambodia, there were 122, and 120 of those have recovered. And there have been no new cases since mid-April. So thank you for your questions. Sorry, just to reflect on those statistics, I do want to just build on Surya's point that testing is very low in these countries, and especially in our villages. We're not expecting any tests to be happening. However, in Nepal, for example, there haven't been any cases in hospitals of respiratory problems, but we are going to base our program on the fact that these villages will be hit, and we do need to support them as much as possible. So we will wrap up now. Thank you all for your questions. I'll come back to Tim for some last closing comments.
Thank you. And look, I think on behalf of everybody here, I'd just like to thank Gemma for hosting this one, but also Surya. I know it's getting late there in Nepal, so thank you very, very much for bringing us up to speed. Greg, thanks for all your ongoing advice and support and taking the questions today. So many thank you to you guys. Of course, it'd be remiss for me not to say thank you very much for everybody attending. We can only do what we do because we have such fantastic supporters. It genuinely means a lot actually to have the people on the call right now that have been with us for many years. You know who you are. I won't call you out by name, but I just briefly wrote down the countries we are currently talking to right now, and I will miss somebody out, and I'm really sorry, but I've got Bahrain, Germany, Dubai, Holland, Nepal, US, Switzerland, and of course the UK. That's just on the call right now. I'm sure I've missed somebody out as well. But look, we have genuinely got an amazing network of supporters. We need your support to keep doing this. I hope that's been helpful to bring you up to speed. There's lots and lots of details about what we're doing on the website, and if you do know people who can help, we will obviously be delighted to talk to them. And our number one priority is to look after our students for the long term and make sure that education ultimately can transform their lives, and that they can live a much better life as a result. So thank you to everybody for coming along. Please stay safe, stay well. It's the bank holiday weekend here in the UK coming up. Enjoy it if you're about to start a public holiday, bank holiday weekend. For everybody else, please do have a lovely Friday and enjoy the weekend when you get there. But thank you very much, one and all. Stay in touch, stay safe, talk soon.